Hi everyone, I'm Lu. Today I will be presenting a situation analysis for health focusing on the Public Health Initiative edition. This analysis will cover the external environment, the industry competition, the stakeholders, the internal resources, and the risks, in order to understand where health is positioned right now. Health is a knowledge as a service platform that shares the latest healthcare innovation with a global audience. More than just an e-magazine, it delivers expert-led content on demand. The Public Health Initiative edition supports UN SDG 3 by promoting health and well-being for all. Its vision is to inspire healthier life by making reliable and practical health knowledge accessible for everyone. Its mission is to empower communities, policymakers, and institutions with research-based content that they can trust. Now I will discuss the product definition by using the tree diagram. The Public Health Initiative edition can be divided into four main streams. The first stream is disease prevention, which includes vaccination campaigns, infectious disease control, and screenings. These are core areas of public health where governments and NGOs are already investing heavily. The second stream is lifestyle and wellness, which focuses on nutrition, physical activity, and mental well-being campaigns. These topics connect directly with the public and address global challenges such as obesity and mental health awareness. The third stream is health policy and governance, which covers new health laws, government funding announcements, and global health policies. This content strengthens Health role as a thought leader and makes the magazine more relevant to policymakers and academics. The final stream is community spotlights, which highlight grassroots projects and local health campaigns. These stories provide a human perspective and show how public health initiatives succeed at the community level, building trust with readers. While health covers a wide range of topics from clinical research to wellness, the focus here is on the Public Health Initiative edition. This edition includes vaccination campaigns, mental health awareness, lifestyle disease prevention, and grassroots projects. The competitors fall into three main groups. First are the institutional competitors, such as WHO, UNICEF, and government health portals, which publish official health campaigns and information. Second are the substitutes, which include social media creators on platforms like TikTok or YouTube, health podcasts such as ABC Health Report or Johns Hopkins Public Health on Call, and AI health tools like Ada Health and Boy Health, which are interactive symptom checkers that guide users through self-diagnosis and basic health advice. These tools compete directly for the same attention health is seeking, especially among younger digital-first audiences. Third are the commercial competitors such as WebMD and Healthline. WebMD attracts more than 65 million readers each month, while Healthline has now overtaken WebMD in audience reach through its strong use of SEO strategies. For this analysis, I am focusing on the Public Health Initiative edition of Health The timeframe is a 2-year cycle from 2026 to 2028. In terms of geography, the magazine has a global outlook, but the main emphasis is on the Asia-Pacific region, especially Australia, Singapore, and India, where public health policies are driving strong momentum. The strategic aim is to raise visibility and credibility in prevention and wellness, position Health as a trusted partner for ministries, NGOs, and universities, and expand digital readership by aligning content with prevention campaigns, seasonal health issues like heat stress and antimicrobial resistance, and the broader SDG goals. Now I will discuss the external environment using the PESTER framework. Politically, the Australian government has committed $292 million to its National Preventive Health Strategy 2021 to 2030. This demonstrates strong political support for prevention and early intervention, which creates opportunity for Health to align its content with government campaigns and build long-term partnership. Economically, prevention spending is still less than 3% of health budgets across OECD countries. In Australia, it is around 2%. In the United States, it is about 2.5 to 3%. And in the United Kingdom, it is roughly 5%. Spending rose sharply during the COVID-19 pandemic, but has since normalized. This underinvestment is both a barrier and an opportunity because half-Asian can position itself as a cost-effective prevention partner. Socially, mental health is a rising concern. In Australia, around 42% of adults will experience a mental health condition at some point in their life. At the same time, the World Health Organization has warned of a global infodemic where misinformation spreads faster than facts. These social pressures create space for half-Asian to provide trustworthy, accessible, and stigma-free content. Technologically, healthcare is being transformed. Since 2020, Australians have taken part in over 100 million telehealth consultations, making digital care mainstream. Globally, AI health tools like Ada Health and Boy Health are growing rapidly and competing directly for user attention. Half-Asian can embrace these digital trends while differentiating itself with expert-led credibility. Legally, health communication is tightly regulated. In 2025, Google updated its healthcare advertising policies, introducing stricter rules for preventive health claims. This highlights the need for half-Asian to embed compliance into its publishing process to protect visibility and maintain advertiser trust. Environmentally, climate change is becoming a critical health issue. By 2030, about 1.2 billion workers worldwide may face heat stress, while Australia's climate and health strategy highlights rising risks from extreme heat and vector-borne diseases. Half-Asian can address these issues by running seasonal campaigns on climate-related health, reinforcing its alignment with SDG 3. Now I will move on to the microanalysis using Porter's 5 forces. First, the bargaining power of buyers is high. Buyers are the readers in this case, have a lot of choice. They can go to free government sites like WHO, NGO portals, or big commercial sites like WebMD, one of the most trusted health information websites. But Healthline has now overtaken WebMD in audience reach. This means loyalty is weak, people can switch easily. For half-Asian, the way to stand out is by focusing on expert-led, prevention-based content that directly links to SDG 3. Second, the bargaining power of suppliers is moderate. Suppliers in this case are the experts, researchers, and writers who provide content. There are many professionals out there, but the most credible voices hold more influence. Research shows that the quality and credibility are what really drive trust in health websites. This means half-Asian needs to secure strong partnership with university, NGOs, and ministries to keep a reliable flow of expert content. Third, the threat of substitutes is high. Substitutes are everywhere. People can turn to health podcasts like ABC Health Report, YouTube channels, TikTok influencers, or even AI tools like Ada Health and Boy Health. These are engaging and quick to access. For half-Asian, the way to compete is by emphasizing credibility, peer-reviewed, evidence-based content that audiences know they can trust. Fourth, the threat of new entrants is moderate to high. It is relatively easy for new players to start blogs, podcasts, or digital channels. However, building a strong reputation and credibility takes time and resources. For half-Asian, this means continuing to grow its recognition and partnership to make it harder for newcomers to displace it. Finally, the level of competitive rivalry is very high. The market is already crowded with institutional players like WHO and UNICEF, and commercial platforms like WebMD, Healthline, and Mayo Clinic. Healthline recently overtook WebMD in audience reach, showing just how fierce and dynamic the competition is. For half-Asian, this makes it essential to carve out a clear niche in prevention and SDG 3 online content. Now I will review the internal environment using a resource audit. In terms of marketing strengths, half-Asian has strong credibility as an evidence-based magazine, trusted partnership with academics and NGOs, and alignment with SDG 3, which makes it attractive to policymakers. For non-marketing strengths, the platform benefits from a digital-first model, which means low distribution costs and global scalability. It also has strong editorial processes with a focus on curating and fact-checking research-based content. However, there are also weaknesses. Marketing weaknesses include limited brand recognition compared to global competitors like WebMD and Healthline, and a small marketing budget that makes it hard to compete with visibility on major platforms. Non-marketing weaknesses include a small editorial team which limits capacity to scale content output, gaps in technical infrastructure such as AI-driven tools, and limited customer service resources for handling feedback or live interactions. Next, I will analyze health valuation using Porter's value chain model. Starting with intangibles, the organization's biggest strength is its credibility as an expert-led health magazine. Its alignment with UN SDG 3 adds legitimacy and global relevance. For inbound logistics and procurement, health valuation relies on partnership with experts, NGOs, and academics, supported by a rigorous peer review and fact-checking process. Looking at operations, the digital publishing model provides global scalability and efficiency. However, there is a weakness in terms of limited investment in advanced tools such as interactive dashboards and AI personalization, which competitors are beginning to adopt. For marketing and sales, the focus on prevention and public health is a unique differentiator, but low brand recognition and a small budget continue to limit visibility. Finally, in terms of service, health valuation engages audiences through social media and online forums, which helps build loyalty. However, resources and direct customer support remain limited, which could affect responsiveness to readers. Now I will move on to the stakeholder mapping. Employees are critical because their expertise in writing, editing, and research drives the credibility of the magazine. However, they face risk of burnout and turnover, which means health valuation must provide training and supportive workplace culture. Readers and customers also have high influence. The magazine's survival depends on their trust. If the content is perceived as biased or outdated, readers can easily switch to alternatives like WebMD or Healthline. On the other hand, if health valuation consistently delivers reliable and accessible information, it can strengthen reputation and readership. Suppliers and partners, including universities, NGOs, and health experts, are medium impact but still very important. They supply the evidence base and expert voices that differentiate health valuation from casual blogs or influencers. If partnerships are strong, the magazine gains authority. If weak, credibility suffers. Communities have a big impact too. They spread awareness through local campaigns and projects that health valuation can showcase. But if the content fails to connect with cultural values, communities may disengage. Aligning with global health goals like SDG 3 helps maintain relevance. Governments and policymakers carry significant influence. Their preventive health strategies and funding priorities create partnership opportunities. At the same time, sudden regulatory changes, for example in advertising policies, could limit operation. Building alignment with government policies is also critical. Finally, advertisers and sponsors play a medium but important role. They provide financial sustainability, but if readership falls, they may withdraw. Diversifying sponsorship sources helps reduce this risk. Now I will discuss the critical success factors. The first is credibility and authority. The WHO has warned about the global infodemic, where misinformation spreads faster than facts. Health valuation fact-check and peer-review content gives it a unique advantage in standing out as a trusted source. The second is strategic partnership. Research shows that 61% of healthcare leaders plan to form external partnerships, while Australia's health strategy calls for collaboration to achieve long-term goals. For health valuation, partnership with ministries, NGOs, and universities not only increase reach but also add legitimacy. The third is content accessibility and timeliness. The global digital health market was valued at $285 billion in 2024 and is expected to reach $937 billion by 2030. In Australia, there have been 118 million telehealth consultations since 2020, and about 70% of Australians search online for health information before consulting professionals. These trends mean health valuation must deliver content that is fast, clear, and supported by digital tools such as AI. The fourth is navigating a small budget and team. While resources are limited, this also allows Health Foundation to be more agile and responsive than larger competitors. By focusing on niche areas and building loyal communities, it can achieve sustainable growth at relatively low cost. Now I will explain the risk assessment. The most critical risk is the spread of misinformation, which is rated as extreme. This directly threatens credibility, so Health Foundation must rely on rigorous fact-checking and clear brand communication. The second is new, well-funded competitors, which are rated as high risk. To respond, Health Foundation must build sustainable advantages through unique, authoritative content and a loyal community. The third is shift in government health policies. Rated as medium, this can impact partnership and campaigns, so regular monitoring of the political and legal environment is necessary. The fourth is cybersecurity threats and data breaches. Although the likelihood is low, the potential impact is critical, so this risk is rated as high. Protecting data is essential to maintaining trust. The fifth is the loss of expert contributors, rated medium. While not very likely, losing contributors would reduce content quality. Maintaining strong professional relationship and building a pipeline of contributors will help manage this. The final risk is low reader engagement, rated medium. To address this, Health Foundation must use data analytics and feedback to keep content relevant and engaging. Now I will move to the SWOT analysis. The strengths are credibility from evidence-based content, strong partnership with academics and NGOs, alignment with SDG 3, a low-cost, scalable digital model, and rigorous editorial processes. The weaknesses are limited recognition compared to WebMD and Healthline, a small marketing budget, a small editorial team, gaps in technical infrastructure, and limited customer service capacity. The opportunities include rising public health awareness, more than 100 million telehealth consultations in Australia, $292 million in prevention funding, the urgency of climate health issues such as heat stress, and the global demand for authoritative health information. The threats include the spread of misinformation, intense competition from rivals and influencers, cybersecurity threats, stricter advertising regulations, and possible reduction in government health funding. For SO strategies, Health Foundation can leverage its editorial credibility and digital model to lead in digital health coverage, secure partnerships with governments and NGOs, and position itself as the antidote to the infodemic by combining expert networks with rigorous fact-checking. For WO strategies, Health Foundation can overcome limited recognition and budget by partnering with established institutions to co-create content. It can also close technical gaps by collaborating with university to pilot interactive tools and AI personalization, positioning itself as an innovator. For SD strategies, the organization can directly combat misinformation using its editorial strength, differentiate itself from broad platforms like WebMD by focusing on prevention, and future-proof its model by embedding compliance to adapt to changing policy. For WT strategies, Health Foundation can mitigate its small team and intense competition by focusing on fewer, high-quality articles that generate organic reach, and by building a loyal community that supports engagement while reducing pressure on limited resources. Finally, I will present the problem and opportunity statements. The problem statement is that Health Foundation still lacks recognition compared to global leaders like WebMD and Healthline. It faces the growing challenge of misinformation, operates with limited resources, and must adapt to regulatory and environmental pressures. Without action, it risks being overshadowed and falling behind. The opportunity statement is that prevention remains underfunded, making up less than 3% of OECD health budgets. Mental health is a major growth area, with 42% of Australians likely to experience a condition in their lifetime. Digital health has gone mainstream, with more than 100 million telehealth consultations since 2020. Partnership with ministries, NGOs, and universities are expanding, and climate health issues such as heat stress, which could affect 1.2 billion workers by 2030, are creating new demand. Together, these factors give Health Foundation a clear opportunity to position itself as a trusted, adaptive partner in prevention and wellness. In summary, Health Foundation's strengths are its credibility, expert partnership, and alignment with public health priorities. Its weaknesses are mainly about scale, recognition, and limited resources. However, by focusing on credibility, partnership, timely content, and agility, Health Foundation can successfully compete in a crowded market. That's all for my presentation. Thank you.